Hello students, today's topic for discussion is mediastinum. What is mediastinum? It is a space between two pleural cavities and their contained lungs. What is the extent of mediastinum? It extends from root of neck to the diaphragm vertically and from sternum to the vertebral column antero-posteriorly. In this slide, we can see the transverse section of thorax showing mediastinum, which is depicted in green color. So it is a space between two lungs. As mediastinum is a broad central partition which includes so many viscera which are very important like heart and other structures of thoracic cavity. So for our convenience, it is divided into certain subdivisions. So here we can see that how the mediastinum is divided by an imaginary horizontal plane which extends from sternal angle to the intervertebral disc between T4 and T5 vertebra. And the divisions which are there, they are superior mediastinum and inferior mediastinum, which is further divided into three more subdivisions, namely anterior mediastinum, middle mediastinum and posterior mediastinum. In this slide, we can see the imaginary plane which is dividing the mediastinum. This plane extends from sternum to the inferior border of T4 vertebra. In this diagram, a dotted yellow line depicts the plane of division, and the area or the space above this dotted line is superior mediastinum, which consists of great vessels like superior vena cava, left and right brachiocephalic veins, which are placed anterior and to the right of yet another great artery or the great blood vessel, that is the aorta. So all these structures above this dotted line, yellow dotted line, are the contents of superior mediastinum. Below this line, we have the inferior mediastinum, and in the middle we can see the most important viscera, which is the content of middle mediastinum, that is heart. This is depicting the subdivisions of mediastinum, superior and inferior. In this diagram which is given below, we have labeled superior mediastinum, which is pink color space, green color space is anterior mediastinum, red space is middle mediastinum, and blue is the posterior mediastinum. This flowchart depicts the subdivisions of mediastinum. Now we will talk about all these subdivisions and their contents one by one. First of all, we will be discussing superior mediastinum. In these two images, we can visualize the various important structures of superior mediastinum, how they are placed from anterior aspect to the posterior aspect. Anterior most structure is thymus, though it is not shown over here, and then after thymus we have the veins, brachiocephalic veins, and then arch of aorta. The midline structure which we can see over here is trachea. Behind the trachea we have esophagus, and on the right image, on the right side, superior vena cava has been removed, and here we can visualize the nerves, right and left vagus nerves. So, what are the boundaries of superior mediastinum? Anteriorly, it has manubrium sterni. Posteriorly, it has T1 to T4 vertebra. On the sides, it has mediastinal pleura. And superiorly, it is bounded by plane of thoracic inlet. Inferiorly, we have the imaginary line which is shown over here in the form of a plane, yellow colored plane, which joins the sternal angle and lower border of T4 vertebra. So in this slide, we can see on the right side the transverse section of superior mediastinum and the arrangement of all the structures in the superior mediastinum. This is the schematic diagram of superior mediastinum, which is showing the various contents from anterior to the posterior aspect. Anteriorly, we have bilobe structure, thymus. Then we have the veins and the arch of aorta with its branches, trachea, esophagus. So here we are enumerating various contents of superior mediastinum. Thymus, right and left brachiocephalic veins, left superior intercostal vein, superior vena cava. These are the veins which we have in the superior mediastinum. Arteries are arch of aorta with its 3 branches. Then the viscera or the tubes which we have are trachea and esophagus. Nerves are phrenic nerves, vagus nerves, left recurrent laryngeal nerve, one more structure, thoracic duct, several lymph nodes and other small structures, they are also there, which form the content of superior mediastinum. This is yet another diagram depicting the contents of superior mediastinum. Now we'll talk about these contents one by one. First of all, we will discuss the veins. We have right and left brachiocephalic veins. The brachiocephalic veins are formed by the union of internal jugular and the subclavian veins, and their tributaries are vertebral, first posterior intercostal, internal thoracic, inferior thyroid and thymic. Next vein is left superior intercostal vein, which drains upper 2 or 3 intercostal veins, left bronchial vein and left pericardiophrenik veins, and it itself drains into left brachiocephalic vein. Then the next great vein we have is the superior vena cava, which is formed by the union of both the brachiocephalic veins, and it begins posterior to the lower edge of first costal cartilage, and it terminates at the lower border of right third costal cartilage. After veins, we have arteries, arch of aorta with its 3 main branches. As we have already discussed, brachiocephalic artery, left common carotid artery and left subclavian artery, which is shown in the diagram on right side. Arch of aorta begins, or it is a continuation of ascending aorta, and it terminates on left side of the vertebral level between thoracic 4th and 5th vertebra. So these are the branches of arch of aorta, and sometimes thyroidema artery can be given from arch of aorta apart from 3 main branches. After veins and arteries, another content, they are the nerves, phrenic nerve paired, vagus nerve paired right and left, and sympathetic chain. So we'll discuss these nerves one by one. First of all, right phrenic, it passes anterior to right subclavian artery because it has to reach the diaphragm as the name implies. So it has to cross the inferior mediastinum also. Basically, it enters the middle mediastinum on the right side of heart, and it passes anterior to the root of right lung, and it leaves the thorax by piercing the diaphragm with the inferior vena cava at the level of thoracic 8 vertebra. The next is the left phrenic nerve. It enters similar to the right phrenic nerve. It lies lateral to left vagus and left brachiocephalic vein. It descends on the lateral surface of arch of aorta, and it passes superficial to left vagus and superior intercostal vein. Then it reaches middle mediastinum, where it lies on the left side of pericardial sac, anterior to the root of left lung. And it also pierces the diaphragm near the apex of heart. Then we come to the vagus nerve. First of all, we'll discuss right vagus, which lies parallel to the trachea, and it descends posteriorly to the root of right lung, and it gives certain branches to esophagus, cardiac plexus and pulmonary plexus. Then we have left vagus, which lies between left common carotid artery and left subclavian artery. It passes posterior to the root of lung to reach the esophagus, and it gives branches to esophagus, cardiac and the pulmonary plexus. Then a very important branch of left vagus is left recurrent laryngeal nerve, which rises from left vagus, winds around the arch of aorta to go superiorly in the groove between esophagus and trachea, which we can see in the diagram given on right side, that how it winds around the arch of aorta to reach the tracheoesophageal groove. Next content after nerves, they are the tubes, which are the midline structures, trachea and esophagus. Trachea is present anterior to esophagus, and it divides the level of sternal angle into right and left principal bronchus. Then we have esophagus, which starts at C6 vertebra and it terminates at the cardiac opening of stomach, which lies at thoracic 12 vertebra. Level is thoracic 12T12. And it is crossed laterally by a zygous vein on the right side and arch of aorta on the left side. Now in this diagram we can see that esophagus is not only confined to superior mediastinum, it is also the part of posterior mediastinum, or the content of posterior mediastinum. Now after the tubular structures, we have the lymphoid organs as the content of superior mediastinum. They are lymph nodes, thoracic duct and thymus. Thoracic duct is the major lymphatic vessel of the body. It enters the superior mediastinum from below at the level of T4, T5 vertebra. Then it continues through the superior mediastinum, posterior to arch of aorta between esophagus and left pleura. And the interiormost structure is thymus, which is a bilobe gland, and it is involved in early development of immune system. It is large in size in case of children, and at puberty it starts atrophy. Clinical importance of superior mediastinum. The prevertebral layer of deep cervical fascia, it extends to the superior mediastinum and it is attached to the T4 vertebra. Now, because of this attachment, if we have any infection in the neck behind this prevertebral layer, this infection cannot drag down from the superior mediastinum. So, any infection behind the prevertebral layer will not reach the inferior mediastinum. It will be confined to the superior mediastinum by the virtue of this attachment. Then, pretracheal fascia, or the layer of deep cervical fascia, it extends into the superior mediastinum from the neck and it is blending with arch of aorta. So if there is any infection in front of this pretracheal fascia, this can reach up to the anterior mediastinum. This is shown in this figure. Here we can see two black bold lines which are depicting anteriorly the attachment of pretracheal fascia. We can see that how it is blending with arch of aorta. So if there is infection anterior to this pretracheal layer, it will trickle down in the anterior mediastinum. But if there is any infection behind the prevertebral fascia, it will not reach the posterior mediastinum because of its inferior attachment to the T4 vertebra. This is another clinical aspect related to the compression of superior vena cava, which is an important content of superior mediastinum, and this condition is known as superior vena cava syndrome. What is there if because of any growth or because of any enlarged lymph node we have compression of superior vena cava? It results in engorgement of the veins which are draining our head and neck region, and this results in edema of the face, neck and upper chest, which is known as superior vena cava syndrome. Coming to the inferior mediastinum. This diagram depicts the contents and the boundaries of inferior mediastinum. We already know that inferior mediastinum is divided into further three subdivisions: anterior, middle and the posterior mediastinum. First of all, we will discuss anterior mediastinum. What are the boundaries of anterior mediastinum? You have to note that it is the narrowest part of the mediastinum. Anteriorly, it is bounded by body of sternum. Posteriorly, it is bounded by pericardium. On the sides, we have mediastinal pleura. Superiorly, the imaginary plane extending from sternal angle to the T4 vertebra. Inferiorly, it is bounded by diaphragm. What are the contents? Few contents we have in the interior mediastinum. Thymus, especially in case of children, it is an important structure in children. Sternopericardial ligament between sternum and the pericardium. Internal thoracic artery and its branches. Then lymphatics and lymph nodes. These are the boundaries and the contents of anterior mediastinum. Then we come to the second subdivision of inferior mediastinum, middle mediastinum. What are the boundaries of middle mediastinum? Anteriorly, it is bounded by posterior surface of sternum. Posteriorly, it has esophagus, descending thoracic aorta and a zygous vein. On each side, we have mediastinal pleura. Contents are: most important viscera is heart enclosed in pericardium, along with various arteries, veins and nerves, and tracheobronchial lymph nodes. Then we come to the third subdivision of inferior mediastinum, posterior mediastinum. Boundaries are: anteriorly bounded by pericardium, bifurcation of trachea. Posteriorly, it is bounded by T5 to T12 vertebra. Superiorly, it has transverse thoracic plane. Inferiorly, we have diaphragm, and on the sides we have mediastinal pleura. Contents are: esophagus. So esophagus is the content of superior as well as posterior mediastinum. Thoracic aorta, descending thoracic aorta. Zygous vein, thoracic duct. Thoracic duct was also the part of superior mediastinum. Vagus nerve, a part of both the mediastinum and sympathetic trunk. Coming to the applied anatomy, you should be aware of the term mediastinitis, which is the infection of mediastinum because of any pathological condition in neck, and this infection spreads into thoracic cavity. Infection in pretracheal and retropharyngeal spaces extend into the mediastinum, as we have discussed earlier. Cause can be bronchogenic carcinoma, aortic aneurysm, enlarged lymph nodes, as in Hodgkin's lymphoma. Clinical picture will depend upon the structure which is compressed. Engorged veins will be there due to severe compression. Dyspnea can be there due to compression of trachea. Dysphagia, difficult swallowing due to compression of esophagus. Dysphonia due to compression of left recurrent laryngeal nerve. Mediastinal widening is the clinical condition which is usually observed on chest x-rays. Cause is hemorrhage, that is the accumulation of fluid because of the injury of great blood vessels or enlarged lymph nodes. And middle mediastinum is enlarged in case of congestive heart failure. Then a very important term which you should know is mediastinal shift. Mediastinum shifts to the diseased side due to the decrease in the volume of lung, which is seen in case of collapsed lung, which is also known as atelectasis. In certain conditions, mediastinum can shift to healthy side or the unaffected side whenever there is increase in the intrapleural pressure on the affected side, which is seen in case of pneumothorax or hydrothorax. So you should be able to differentiate that mediastinum can shift to disease side whenever there is decrease in the volume of lung, but it will shift to healthy side whenever there is increase in the volume of lung, and it is detected by palpation of trachea. So let's revise whatever we have done earlier. Mediastinum, definition of mediastinum: it is the partition between two pleural cavities and lungs. It includes a number of structures. It is subdivided into superior mediastinum and inferior mediastinum, which is further subdivided into three subdivisions: anterior, middle and posterior. Contents of superior mediastinum: esophagus, trachea, arch of aorta, branches of aortic arch, brachiocephalic veins, upper half of superior vena cava, phrenic nerve and vagus nerve. Contents of middle mediastinum are pericardium, heart, pulmonary trunk, ascending aorta, lower half of superior vena cava, upper part of IVC also, and bifurcation of trachea. Posterior mediastinum includes esophagus, descending thoracic aorta, azygous and hemiazygous veins and vagus nerve. In this diagram, line diagram, we can see that how the mediastinum, with the help of sternal plane at the level of sternal angle, it is dividing the mediastinum into various subdivisions, and certain contents are also shown over here. Superior mediastinum contains thymus. We are going anterior to posterior. It includes phrenic nerve, vagus nerve, arch of aorta and some part of esophagus. Below this thoracic plane we have inferior mediastinum. Anteriormost subdivision is anterior mediastinum, which can include thymus if it is large in size, and also part of phrenic nerve just anterior to heart. In the middle mediastinum we have heart, and then in the posterior mediastinum we have vagus nerve. The branch of vagus, left recurrent laryngeal nerve, is a content of superior mediastinum. Here we can see it in pink color, that how it winds around the arch of aorta. Esophagus is this purple color structure, and it is sheared by superior as well as posterior mediastinum. Then we have red color, descending aorta, the posterior most structure. It is a content of posterior mediastinum. And this is the applied anatomy, mediastinal syndrome, and on the right side we can see the chest x-ray, and it depicts the widening of mediastinum. Then we have mediastinal shift, which is shown in the lower figure, that how the mediastinum is shifting to the diseased side whenever there is decrease in the volume of lung. In this diagram we can see the collapsed lung. Thank you.